Welcome back to News in Focus. Medical staff in Gaza's hospitals say they are now seeing babies so severely malnourished without muscles and fat tissue, just the skin over the bones. If a baby, infant or child suffers from malnutrition, their blood pressure will be low, their heartbeat slow, and they can become hypothermic and experience limited motility in the gastrointestinal tract. This comes as Gaza continues to suffer through famine. And though there are aid drops that are occurring, it is not only seen as dangerous, but also the question of, is it enough to cover the entire population of the Strip? Joining me now from Deir al-Balah in central Gaza, I beg your pardon, I'd like to welcome Dr. Mohammed Fadlalla, who is a managing medical doctor for Doctors Without Borders in Gaza. Dr. Mohammed, assalamu alaikum wa rahmatullahi wa barakatuh, and shukran so much for making the time for us.
Wa alaikum assalam wa rahmatullahi wa barakatuh. It's a pleasure to be here.
No, it's an absolute pleasure. Doctor, I think to start off with just the medical crisis that is occurring in Gaza right now, to say it's become worse would be an understatement. This is beyond worse, isn't it? When you look at the children that are malnourished and the famine that is occurring in the Strip at this moment.
Yeah, I mean, I don't know that there's a good word for it. Catastrophic, apocalyptic. I mean, the medical need in the Gaza Strip far outweighs, outstrips the capability of all of us here working, NGOs, the Ministry of Health, all the partners trying to provide what care we can. We don't come close to providing what is needed medically. All of this is exacerbated by the current hunger situation across the Gaza Strip. As you know, malnutrition affects all parts of healing, all pathology, all parts of the body. The most striking photos are the ones we see of the children who are dying of starvation. I myself am currently working in a trauma surgical hospital, and our patients are affected by malnutrition and also various other ways in terms of lack of ability for wound healing, infection fighting, and things like that. So if I'm malnourished, I don't have to starve to death. Even getting shot with a bullet, my malnutrition will affect my ability to recover from it. So to say the situation is catastrophic is even an understatement.
Dr. Fadlalla, given the hospitals that are the ones that are functioning in Gaza right now, and there are very little that are functioning, I think if I stand to be corrected, Nasser Hospital is probably one of the few functioning ones that are there. How difficult does the job for you occur that, obviously with the aid not occurring for you as a medical doctor to operate on, but also at the same time, these hospitals that are functioning on practically nothing, given that there's also a lack of fuel in so many of these medical facilities, I beg your pardon. Talk to us about that.
How is the task? The task is an impossible task, and I think all of us here recognize that it is an impossible task. We do not have the capacity or the capability to provide the level of care that they deserve and that they're owed by human rights. What we're doing is trying to put together a collective effort, not just our hospital. We are working in conjunction with all our partner hospitals, all in Central Gaza and the North and the South, to do the best we can to collectively do the best we can for everybody. Just as an example, from our day-to-day from today, we are a trauma surgical hospital, and many of the cases we see are broken legs, fractured legs, amputated legs, legs that need surgical repair in arms and limbs. One of the big things that we do is orthopedic surgery. We do not have the equipment to perform the surgeries on the patients that we currently now have waiting for surgeries with open, fractured legs. Every day you wait with an open fracture in your leg or in your arm is another day that can turn into an infection and make a bad problem into a much, much worse problem. So we are running around talking to all our partner sections just so we can have the equipment, the external fixators necessary so we can take care of the patients that we already have in our wards. And this is not counting the patients that continually are coming in hour after hour with fresh bullet wounds and bullet holes and fresh fractures and everything like that. So in short, the task is impossible, and us, along with all our partner hospitals and from the ministry and the international organizations, are doing the best we can to work within this impossibility, in this impossible situation.
Dr. Fadlalla, I want to look at a statement that, of course, MSF had released, and that statement that said that this has to stop, that the borders need to completely open. There needs to be complete aid coming through. And, of course, the man-made starvation that is being created by Israel needs to stop at this moment. I just wanted to get your personal take on families that you've had to deal with, individuals that you had to deal with. You yourself also, as I'm speaking to you right now, I don't even know if you have gotten a proper meal during the start of this famine that is occurring. Talk to us about that, and just how you need to also make sure that you, as a medical professional that have taken an oath to help the people, how do you balance that? How do you find that balance to make this work?
Yeah, I mean, I can speak for hours on this. I can tell you the staff that we work with, our Palestinian colleagues who have been in Gaza since day one, working day in, day out, they haven't eaten properly in the last 5 to 6 months. Late last week, on 2 separate conversations from 2 different, one of the doctors, one of the nursing supervisors were talking, and they had a very similar story. And I imagine this story is common among all the staff. They're eating what little they have as a family, and the staff and his wife are pretending to eat so that the children can eat and get their fill, and then only whatever is left do they then eat, and it's usually very, very little. So and then they come to work in the morning and they have their 8-hour shift, or they come at night and they have their 16-hour shift, and they come not having eaten. Many times our hospital does try to provide 1 meal a day for the morning shift and 1 meal a day for the staff for the evening shift. A lot of times we're unable to provide that, and they're having to work kind of the whole day or the whole night, or sometimes 24 hours, and then they go home, and the folks at home are hungry. So these personal stories are ever present. Everybody here is touched by the hunger crisis. We are not different than our patients. Our staff here, they're in the same starvation crisis. The only difference is the patients happen to have been shot or suffered a shelling or shrapnel injury, whereas the staff are the ones taking care of them. But this is a crisis, a man-made crisis that's touched everybody who's living here and staying here. And I can't speak enough about how incredible it is for me to see how the Palestinian staff are working day in and day out to, like you said, fulfill their oath to take care of the others who are in a more dire situation than them.
Dr. Fadlalla, you were telling me of you're from Sudan, and our brothers and sisters in Sudan are also going through a very difficult time there with the genocide that's occurring. And I think it brings up extra emotion for you. And it comes to this question: how do you emotionally handle yourself, given that you're seeing these children suffering from starvation, you're seeing the destruction to their bodies because of the continuous bombing by Israel? How do you manage that, knowing that there's a job to be done, but also at the same time you're dealing with a human being that has gone through so much for the last 22 months?
You seek strength from wherever you can in a situation like this. And what I found is I get most of my strength from the staff and the patients that we talk to. When I'm rounding on patients with the team, or when I'm talking to just patients and their families, you may not believe, but every conversation that I have with patients or their families, or even staff, ends with Alhamdulillah, all praises to God. There's a faith here, a contentment, and a belief in a deep optimism here in Gaza, in a higher power in God that they derive their strength from, and through that, I derive my strength from. 6 months ago, I was also in Sudan working in a malnutrition ward, and it was the same idea that when people are at their lowest, that's when they dig the deepest to find what strength they can, and I gain my strength from them, from the patients and the colleagues that I work with.
Dr. Fadlalla, just one final question, and I think the sense of fear will be there for every human being, because Israel obviously goes ahead and bombs every part of the Gaza Strip. How do you manage yourself as a medical professional, knowing that you don't know whether you're going to see the next day or even the day after or even the next hour?
I honestly, I don't think about that. I'm here to do a job, to work with my colleagues, to treat the patients as best I can, to make things, to do my part. And anything outside of that, I don't really think about. And that's how I go by my day to day.
Dr. Fadlalla, may Allah subhanahu wa ta'ala protect you. May He bless you for the good work that you are doing. Shukran so much for joining us. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Much appreciated. Thank you so much.
No, it's an absolute pleasure. That is Dr. Mohammed Fadlalla, Managing Medical Doctor for Doctors Without Borders in Gaza. We're going to come back home. Here in Parliament, Action SA wants to introduce an amendment bill which will see the removal of all current deputy ministers. I'll be speaking to Athol Trollop after the break.